Now, welcome to Frederick Dental Clinic. My name is Heraclio. I'm a Brazilian orthodontics. I graduated in dentistry in 1996, and then straight after that I went into ortho, and then I've been specialized in orthodontics for, I'd say, the last almost 20 years. And then I came to Ireland to learn English, and now I'm able to practice here in Ireland, and that's been 2 years now that I've been practicing dentistry and doing my orthodontics, which I love. I think you might be wondering when to bring your kids to have their teeth checked for braces, right? It's very important actually to do that. I'd advise you to start looking into that at the age of 7, because that's when kids start losing baby teeth and changing from baby teeth denture to permanent denture, especially if you notice your kids are grinding their teeth at nighttime, if they breathe mainly through their mouths instead of through their nose, if they have some biting or chewing habits that don't seem very normal, because intraoral habits can develop malocclusion, can develop kids' teeth in the wrong way, and that needs to be fixed. There are some things that we can do at the age of 7. For example, an expansion of the arch if your kid has a crossbite, for example, at the back. Or at the age of 10-ish, 11-ish, we can start working with the jaws, the lower jaw and the upper jaw. Especially the lower jaw, which is the bone that it's movable in our face. We can push that forward or slightly back or slightly sideways to get a better bite and a better cosmetics and aesthetics of your kids later when they're older. If you miss that opportunity when they are growing, it's very hard to achieve a very good results when they're older, because I don't have the growth to help me. I'll only be able to move teeth, and I won't be able to actually move bones and help with the whole process of the bite settling for the kid. Treatment length can vary depending on what procedure we're going to do. When we treat kids, we don't treat everything all at once. We target spot, crossbite, overjet or overbite or intraoral habits, and then we treat those. So it can be somewhere between 4 months and a half to 6 to 8 months at most, okay? And then, of course, when they're grown up, if they need fixed braces, and then we can do as well the full comprehensive treatment at that age. We pretty much offer the whole variety of appliances in the market. Kids usually, when it comes to expanders, I personally like fixed expanders because I don't need the compliance of the kid. So a fixed, like a Hyrax or a Haas or a McNamara, for example, they are all different kinds of fixed expanders that will expand the upper jaw. Sometimes we need expansion on the lower jaw, and then we have to go for removable appliances. Sometimes we need a lower jaw advanced because the kid, for example, has an increased overjet or bite on their lips, for example, or have a tongue thrust or lip thrust or something like that, and then we'll go for a bionator or a twin block, which is removable appliance. So we can use a mix of removable appliance and fixed appliance, even sometimes brackets, the train tracks itself on a few permanent teeth to level and align them slightly before they are teenagers. If you'd like to become a patient, all you have to do is give us a ring at 01-878-6999 or email us to info@thefrederickdentalclinic.com. And you can check our results online as well at thefrederickdentalclinic.com and call in if you want in person to 33 Frederick Street North, We're based in Dublin 1, and you also have the option to go online and just on our website, thefrederickdentalclinic.com. Your first consultation will be free of charge. We'll assess your son or your daughter, we'll request an OPG, an X-ray, and we'll chat about treatment plan options for him or her.